Namaste. I am Dr. Shama Kazi from Faculty of Physiotherapy and Diagnostics. And today in this video, we are going to talk about upper limb prosthesis. So let's begin. Times of the essence when dealing with upper limb amputation and prosthetic restoration, delay in initial prosthetic fitting, and training is a major factor for prosthetic rejection. Uh, if we are talking about the clinical practice, the prosthetic prescriptions are factors of consider when selecting prosthetic components are amputation level, residual limb geometry, sensation, range of motion, strength, cognition, vocation, hobbies, importance of cosmesis, financial resources available, and environment and weather. Control system. Processes can be controlled using body power, externally powered, or hybrid control system. Body power system use body movement to control a TD or elbow. And parties include disability, reduced cost, and weight compared with others. So, as you understand the thing, what this is wanted to say that processes always depends on the residual limb, the capacity of the patient to handle the prosthesis, and the cosmosis. If we are saying the control system, so an externally battery power system may use electrical switches or myoelectric signals for control. Electrical switches can be activated by residual limb movements within the socket or by other body parts. Myoelectric system or electromyography signals generated during muscle contraction. Terminal devices are prosthetic hand, jaw chunk pinch, and hook provided the equivalent or lateral or tip pinch. Body power control allow for voluntary opening or voluntary closing, but not for both. Voluntary opening devices are maintained in the closed position by rubber bands or springs. Voluntary closing devices are maintained in the open position and closed when tension is applied through a cable connected to a harness. Prosthetic limb wrist. The lightest and simple prosthetic wrist is a friction control unit which permits passive movement but can rotate when lifting heavy object. A locking, quicking, disconnect wrist allow locking in the desired pronation, supination position and rapid interchange between differences. Prosthetic elbow. Externally powered elbow can be controlled with a switch or a myoelectric control. Internal and external rotation can be provided with a rotating turntable. Prosthetic shoulder. Most shoulder joints allow passive abduction and flexion through a bulkhead or universal joint with a desired position maintained by friction, chin control, or electric lock. However, there is increased risk of other things, a combination of weight, diminished over control across multiple joints. Prosthetic socket. Most upper limb prosthetic sockets are double layered and composed of external carbon, graphite, or rigid plastic material to which the necessary prosthetic components are attached. The inner socket is fabricated from a cast of patient residual limb and can be constructed of a flexible plastic. Suspension system. A harness spans the prosthetic divide of the body while providing body power control. A figure 8 harness or a figure 9 harness is commonly used for the transradial or transhumeral amputees. A harness loops around the contralateral axilla to anchor and suspension the control cables. A chest strap is an alternative for those who find the axillary pressure uncomfortable. Hope you understand it well. If you have queries related this video, ask me in comment section. This video is powered by digital version of 2.0 Jyoti Vidyapit Women's University. खुश रहिए.